Do you notice your baby is only looking to one side consistently? This is a condition called Torticollis, and we treat it here at T.E.A.M for Kids for physical therapy. My name's Alyssa, I'm a physical therapy assistant. This is Steve, a physical therapist here as well. And we'll talk a little bit about what to expect if your baby does have Torticollis.
Okay, so one of the first questions that we'll get asked is what exactly is Torticollis? Torticollis is a tightening or stiffening of the neck that will cause a rotation to one side and typically a tilt to the opposing side. It can be caused by how the child is positioned in the womb. It could be caused by just different tightness and positioning practices at home, and it can result in real stiffness in the neck. Now, the other thing to look at with torticollis is whether that is a structural issue with the vertebra, or whether it is a true torticollis where it's just the neck musculature that's tight, one of which that we can treat through gentle stretching, and the other which may require further treatment. Okay, and then some of the negative effects of torticollis could be the shape of the head getting flattened on the side of the tilt. So if your child's laying on their back with their head just kind of tilted off to one side like this, you'll oftentimes see the side of the head flattened, and then that ear could shift forward and their face could be asymmetrical. We want to avoid that through positioning techniques and stretching. With that head shape change, you could get vision issues, you can have balance issues, and you could often have gross motor delays.
So how does PT treat torticollis? One great way we treat, like Steve was saying, is through gentle stretching. So if your kiddo is referred for physical therapy because of torticollis, they'll come in, they'll be seen by a licensed physical therapist or physical therapy assistant, and we'll work on some gentle stretching, we'll work on active movement to also decrease that preferred rotation to one side, and also work on some of those skills they may be slightly delayed in. So I'll just go ahead and demonstrate a couple of our most common exercises or stretches that we give out. Home exercises are really important with kiddos with torticollis. So if you're doing physical therapy, often the physical therapist will give you a set of stretches and exercises to do at home. So the first one is called the football hold. This is typically done on the side where you notice the tilt. So if your kiddo is tilted to the right, so our baby is here, we're gonna do a football hold where the right ear is down towards the ground. You're gonna slide your arm under, other hand is gonna come through the legs, grab that bottom arm, and you're just gonna slightly pull head up. So essentially stretching, if you were to be standing, bringing your opposite ear to opposite shoulder. Do a nice 30-second count. You can sing the ABCs, that generally is about 30 seconds. Let the kiddo relax out of it. Another common stretch we do is rotation to that same side. So again, if they are tilted to the right hand side, you're gonna rotate to the right side. So you're gonna have your kiddo sitting in your lap, kind of back against you. You're gonna have one hand, so particularly the one on that side, holding the opposite shoulder against you. So that way they can't lift that left shoulder. And you're just gonna take the hand and slowly have them rotate. Easier on a real kid versus a baby doll, and you're just gonna hold them here so they're stretching into that limited rotation on that side.
Okay. Outside of the gentle stretching and positioning techniques that will be discussed in the physical therapy evaluation, treatment for the head shape can be done with what's called a cranial orthosis or a helmet. So if the head shape is really severe, a helmet might be necessary in order to help with that head shape. If it's just a minimal change in head shape, then a lot of times the positioning techniques and the stretching and taking care of where the pressure is on the child's head can help resolve that without a helmet. But to determine whether a helmet is needed, it's best to get them evaluated and taken a closer look at. There should be a picture of the helmet up on the screen right now.
Early intervention is super important, particularly if you notice your baby is really preferring that only one side. We highly recommend coming in for an evaluation. As I mentioned, home exercise program is super important for torticollis. That carryover at home, the positioning that Steve was talking about, really encouraging the opposite rotation and the stretches really leads to a great resolve of torticollis typically, and it's important moving forward.
And as Alyssa said, early intervention is the best. So even if the child is only a few weeks old, you notice them tipping their head only to one side, they don't want to stretch over to the opposing side, or you see them tilted off to the side all the time, you want to make sure that you get them evaluated sooner than later, because it's much easier to fix when they're younger. Some of the signs that you can see, other than just the rotation and the tilt, is if you look at the neck and there's some deep red creases inside that neck area, that's a sign that maybe they're just positioned in that position for too long and that skin gets irritated. So just take a look at your child's neck. If there's little deep creases or red lines in there, then they may have torticollis as well. And it's better safe than sorry. Go ahead and get them checked out, get those stretches started early. If you want to schedule an evaluation for that, just give us a call at T.E.A.M for Kids, and we'd be happy to take a look at the child for you.